The microbiologist Dr. Leslie Ramsammy has enjoyed one of the most successful stints as Minister of Health in Guyana and is particularly known for his leadership in the fight against HIV/AIDS. In his long career, he has been recognized as a regional and global leader in public health. Now, he is back at the ministry as an advisor. His job includes leading the rollout of the COVID-19 vaccines to ensure that Guyana exits the pandemic. In this week's Insider, he told me about the ministry's effort to get the vaccines out, and he answered questions about how safe the vaccines are. So, Dr. Ramsammy, if I've tested negative once, twice, 3 times, should I still take the vaccine?
Even more so, you should take the vaccine so you could stay negative forever.
But why do I need to take a vaccine if I don't have COVID?
Because COVID will come to everyone eventually if we allow it to keep circulating. And therefore, that's the essence of a vaccination program, is that we eliminate any possibility of transmission. When you say, I've taken it once, twice, 3 times, and I'm negative, so I'm good, well, you're playing roulette, right? Because the 4th time you may not be as lucky, right? So that's the reason. The bigger question is, should I take it if I have been tested positive before? COVID-19 status is not an eligibility requirement. And therefore, a person who have tested positive before, even a person who have been in a hospital are still advised to take the vaccine. Because we have short supply, we may want to say to people, if you have had it, if you've tested positive before, give somebody else a chance for now, because you have some inherent protection at this moment.
If I tested positive, you said?
Yes.
I don't understand.
Okay, because if you tested positive for COVID, it means you had the virus. And if you had the virus, you would have developed some antibodies to the virus. So you may have, the science is not yet fully there, but you may have. Scientific knowledge tells us that you may have some short-term protection against reinfection.
You mean if I was positive and I've moved to negative?
No.
Sorry, I really don't understand.
Yeah. If you were positive before and you no longer are sick, you will now test negative for the virus on a PCR test or an antigen test. But an antibody test for COVID will show that you have antibody because you were previously infected. And so these people have a little bit of an immunity. We still want them to take the vaccine for long-term immunity, but in a short supply situation, we may say, give somebody who has never been infected, who is kind of virgin in terms of the COVID, let them protect themselves. And you wait for when we get more vaccine.
So, Dr. Ramsammy, people are afraid of taking vaccines. You say they should not. Why?
Because we have used vaccines in this country for more than 60 years. Presently, we have 19 vaccines that we use in our country very, very safely. Around the world, for 60 years now, vaccines have helped us to eliminate some diseases. We don't have smallpox, for example, anymore, anywhere in the world. Polio and whooping cough and other diseases are close to elimination point because of vaccine. And therefore, I see no fear in taking vaccine. The present vaccine, more than 120 million people have already received vaccines, and we have no documented case of any adverse events that have happened.
But people can argue that the vaccines that are in the system, have been tested and tried. These are not new like the COVID-19 vaccines. These have been developed within a year. How do you address people's fears that they could become a guinea pig?
But you know, with technology, we do things faster. We have benefited from the technology, the science that we have developed over the decades. And so things that used to take us 10 years can now be done in a matter of weeks. The DNA, the genetic makeup of this virus was done within days after China discovered the virus. And within 24 hours, the Oxford scientists were able to design the first vaccine. Those were things that previously took years. So now we are benefiting from the science that evolved with our experiences with other diseases, and especially HIV.
Well, what's the difference in the different types of vaccines that we have in Guyana? Right now we have the AstraZeneca, Sinopharm, and we're going to get the others. How do you tell them apart?
So the two vaccines that were developed in the US, Moderna and Pfizer, are new technology, vaccine technology. They are based on something called messenger RNA. And I don't want to go into the scientific details. All the other vaccines, whether they come from Russia, India, China, the AstraZeneca vaccine out of the University of Oxford in the UK, these are all using well-established technology. Some use inactivated virus, that's the cold virus, the adenovirus, which is also a coronavirus, that are inactivated, so they carry the vaccine. And some use dead vaccine, dead viruses to carry the vaccine. These are all our previous vaccines that we use are based on these technologies. So that's another thing that I should have added, that the vaccines that most of the world are presently using are based on a technology that have been tested and tried for decades.
So which is the best vaccine to take?
Presently, all the vaccines that are in use, Moderna, Pfizer, AstraZeneca, Sinopharm, Sputnik 5, Novavax, Johnson & Johnson, all of them have proven 100% effective against severe illness. That is, even if you do get COVID-19, you're not going to end up in an ICU or something like that. And that's the first goal for public health. It's always to prevent people from getting sick. The second goal, if we can achieve it, is to prevent transmission. And so in terms of being able to stop serious illness, all the vaccines are effective. And that's my recommendation to the world. The first vaccine you have access to, take it.
Dr. Ramsammy, you've been on the ground a bit what would it take to roll out this vaccine effectively in Guyana, apart from the availability and getting it here?
I'm glad you added that, because that was going to be my answer. And so the question is, what if we were able to put our hands on the vaccine right now? Would we be able to roll it out to all those who want it across this country? And my answer is yes. Because we don't have all the vaccine in hand right now, we are hoping that by April 11th, we will be able to vaccinate more than 50,000 people in our country with the first dose. People must not forget that this country has one of the most extensive vaccination network and rank among the best in the world.
Why is that?
Because, as I told you before, we have 18 vaccines, All of the relevant vaccines for a child is included in Guyana's immunization program. And over the years, we have more than 350 centers spread across this country in the most remotest areas to provide vaccination for children and for adults. And people, this is a good opportunity for me to remind people that this country has won more gold medals for vaccination of our children than any other country in the world. So we have a network out there. We have public health nurses that are well trained to deliver the vaccine. For those people who have experienced the vaccine centers for COVID vaccine, they will tell you that the biggest constraint or the longest waiting time is the registration process, which does not need a nurse. And so as we roll out, task shifting is coming into play. And that's another area that Guyana has gained high marks in the world, because there are things that we do in the health sector that doesn't require a doctor or a nurse. And so we are now bringing in the University of Guyana students, Texilla, the nursing school students, young people who have graduated and have some time on their hands. We're bringing them in to the teams to do the registration process. And one of the other time-consuming things that is done behind the scene is that everyone who gets vaccinated, we try to call within the first 24 hours to make sure that they are okay. It's part of the procedure as we do our surveillance for adverse events that might happen.
So over 10,000 persons have been vaccinated thus far. Have you had reports of adverse side effects, any at all?
We don't have, and I will make a distinction, the adverse events that we're talking about are things that end up with people having to go to the hospital and so on. But all vaccination, whether it's COVID or not COVID, will have some side effects. 17% of people should expect to have slight fever. In Guyana so far, with COVID-19, it is around 10%. But it is not, we should expect around 17%. In terms of, and part of why we may be at 10 and not 17 is the macho thing, I'm okay, right? But in fact, if they reflect a little, yes, they had a little slight fever. About 9% of the people should expect to have soreness in their arm where we jab them. And so far, it's exactly there, 8.9%. And some people would have chills, not fever or so, but some chills, maybe about 5%. And so far, with over 10,000, those expected numbers are what we are getting.
And explain why those symptoms would come about.
Well, remember that forget vaccine for the moment, if you get an infection or something like that, you will get fever or some reaction, rashes, whatever. And when we are putting vaccine into you, that's the idea, right? That it's something that is not normal to your body, and therefore it stimulates your immune system to respond. And that's the goal of vaccination, to teach your body that this thing is not a regular part of your body, so you need to put up a defense. So that's what this is, teaching the body to recognize that this is an enemy, and therefore always be on the watch out for this. That's what we're training the body to do right now.
Many countries in Europe have suspended the use of the Oxford AstraZeneca vaccine. Why isn't Guyana doing that, waiting to see if this is really safe?
And so just before this interview started, those very countries have suspended the suspension and in fact they are resuming. There is some politics going on, but I don't want to get involved with that. The fact of the matter is that this vaccine, any one of the vaccine, whether it's AstraZeneca, Moderna, Johnson & Johnson, any one of the vaccine, they're going to stop us from getting COVID. They will stop us from getting seriously ill because of COVID, but they will not stop us from getting diabetes, other heart diseases, cancer, getting infection from TB or malaria or whatever. These are things that happen before COVID. They will continue to happen before COVID. They will happen to people with COVID vaccine. They will happen to people without COVID vaccine. The thrombocythemia that they reported that some people had after they took the vaccine is something that happened in the regular population. Even for people without. And if you look at the rate at which people who received the vaccine were getting these conditions versus the rate for people who have not gotten the vaccine so far, it's exactly the same. So it's a population event, and the Medical Advisory Group Council of EU have investigated that concern. The WHO has investigated that concern, and both have concluded that there is no link to the reason why some countries decide to suspend for a little and wait. All those countries have now resumed, and for good reasons, because I have told them too that since you think you want to suspend it, send me the vaccine.
So, right, with the rollout of the vaccine in Guyana, you say we have these 350 centers and all this experience, but there's a new movement by faith-based organizations, local authorities, to set up centers of their own. Why is that important?
Okay, so we have 350 centers that are the regular vaccination centers. With this vaccine, because we don't have enough and we are doing prioritization group, we decided not to use all of these centers to avoid the logistics of every day counting vaccine to send. And we don't know how many people will go to a particular one. So we have set up, as of right now, before this interview is broadcasted, we have had by Wednesday 41 fixed sites where we have our team. People are told that they can show up in accordance with their eligibility. So right now we're doing 60-year-old and above. In addition to that, we have teams, roving teams. So for example, when we started out in Region 4, we started at Enmore, the Ministry of Health, Georgetown Hospital, and Diamond. And the idea was the roving teams will then go into communities. Say, for example, we would go one day into Mocha. The team will then go one day, say, into Victoria. One day into Clonbrook. In between the centers, these teams will go spend 1 or 2 days, depending on the size of the community. But we have also now called upon the champions of the mobilizing team, the faith-based organization, churches, mandirs, temples, the churches, the mosques. They have a very effective mobilization of people in general, but the 60 and above, they can bring them into one group. My position has always been, when you're dealing with certain groups, the disabled, the elderly, etc., we should go to them. We shouldn't let them have to come to us. And so the recruitment of the faith-based leaders, the NDCs. So canal number 2 has been based on NDCs recruiting their catchment area. We are going to do others. Coney River on Wednesday, March the 24th. Will be done by the local organizers there, community leaders who are bringing the people to Karma to one place, and our team go there. So that's how we are trying to reach all the people that we have to reach.
Dr. Ramsammy, to get the vaccines into Guyana is pretty expensive. The government has said that it will spend all the money that it needs to. So is this vaccine really the way out of the pandemic for Guyana and the rest of the world?
I think for the whole world, the vaccine is our exit strategy. We have used public health measures and they have been effective, but they have not been foolproof. We have seen that the virus keep being transmitted in spite of these measures. And people are, frankly, fatigued. A lot of people are just giving up on some of these things. And the longer it goes, the more non-compliance we will have. And we just simply can't lock up everybody. So vaccine for me is presently the exit from the pandemic.
But in the meantime, while you're trying to roll that out, the other measures, are they really working? The curfew, for example, does that make any sense to have it from 10:30 in the night to 4 in the morning, or whereabout it is at this point in time?
I don't think any of the measures are 100% effective, but I believe that all the measures contribute in some way to reducing the exposure. Part of the reason for the nighttime curfew that countries are using across the world is that those are the times when small groups or large groups get even closer together. Those are the times when generally when people are hanging around so late, it's a partying type of thing, and they tend to forget some of the protective measures. And they themselves are in danger, but guess what? They're taking that danger home to them. And so it is not 100%, but it contributes even in some small way. And every little thing we have, it's small mercies.
In what particular area would you like to see greater compliance with the COVID measures in place at the moment?
I think the use of masks, the use of sanitizers, etc., I think those are the things that would be most effective.
I do want to ask you, did we manage COVID-19 properly? I know you've had your criticisms about how things started under the previous administration. You came in August, helping the ministry here to try to solve this problem. Did we manage it properly?
I think on an overall perspective, I would have to say no. And I do not want to politicize it, but we started on the wrong foot. What we did in those early days, and incidentally other countries too. So this global inappropriate response was not based on a single political party. But those initial missteps allowed the virus to take root. So we kind of seeded the ground. And therefore, any government that would have taken over at some point after March 2020 would have inherited a major problem because the virus was allowed to take root in different parts of the country. And once this virus, as Europe have proven, as the US has proven, once it takes root, it becomes almost impossible to deal with. And so in spite of a ramp up, a ratcheted up response since August, we see that we have not been able to stop it. I believe that some of the measures have contributed to ensuring that it didn't get wildly out of hand. And I believe that whilst the public health measures help, there are some cultural parts of our lifestyle in this country. And some of the public health measures from before, you would see that countries with high coverage of vaccination, not with COVID, but high coverage of vaccination in general, have not had the damning pandemic that people had predicted last March. People had predicted that Africa, many Latin American countries will be decimated. And we all have a problem, but we have not been as decimated as they had predicted. And you will see, however, when you look at it, that these are the very countries that have fairly high vaccination rates, with particular one vaccine, the BCG vaccine.
So do you consider our death rate to have been low and above expectations?
The death rate, the mortality rate in Guyana is equivalent to what we see in other countries. I want to commend the doctors and nurses and so for the work they have done. But clearly, the rate is too high, whether we're dealing with America or we're dealing with Guyana, whether we're dealing with the UK or Trinidad or Suriname. The rate is too high, and that is why we need the vaccine rollout now.
But you say it could have been much worse if we didn't have such a robust vaccination program in the...
That is part of the contribution. I think that given where the pandemic was in Europe and in North America, and the high mortality rate that those countries experienced, let's go back to, say, April, May, June of last year, one would have predicted that countries like Guyana will not be able to manage this disease. And in fact, you read all of the major publications in the world, Wall Street, New York Times, you would see that they all predicted catastrophe for African countries, for example. And those things have not played out. And don't want to diminish the fact that we all have had a serious problem. But the doomsday scenario did not play out. One, because we all took actions, whether they were adequate or not. We all took major actions. But there was something else in play. And I believe that the public health response, the primary health care things that we were doing in these countries helped.
So Dr. Ramsammy, going forward, the priority is obviously to roll out this vaccine as effective as possible. What would be the most effective strategy in your head?
Okay, one, we have to combine the vaccination with the continued use of public health measures. Continue to wear your mask, continue to sanitize, continue to stay apart as far as possible. In terms of the vaccination, I hope that people will not hesitate to take it. Presently, of the almost 11,000 people, 33% of the health workers have been vaccinated. As of this coming week, we will move to another category. We are now doing 60 plus. We'll move to other category. Those from the initial priority groups that did not take advantage of their prioritization will have to join the line. And so in terms of 60 and above, at this time, we have completed about 10% of that population. And so the priority in the next few days is to make sure that all the shut-ins, the people who are at home and who can't leave their home, that we send our teams to visit them and vaccinate them. We are hoping that within the next 2 weeks, certainly by April 11th, that the vast majority, at least 70% of the elderly population, 60 and older, are vaccinated. I am encouraged by the response from the 60 and older people. I want to encourage the health workers, take the vaccine.